Right, it doesn't look as if we've had any more join in the last few minutes, so maybe we'll make a start and then hopefully people will be able to sort of join as and when. Okay, so a warm welcome and good morning to everybody for joining our webinar this morning, which is nipping it in the bud. And this is going to be first of a series of webinars that we're hopefully going to be delivering over the next few months. Just to introduce myself, my name's Tracy Atkinson. I'm the Clinical Governance Director for PAM Physio Solutions, and I'm an OC Health Physio by background. And I'll be introducing the presenters and obviously any Q&As that come in. Can I just say, if people do have any questions throughout the session, if you can drop them into the Q&A section, and then obviously we can go through those at the end of the presentation. There'll be plenty of time for Q&As. So just to present the speakers or panel to you this morning, we've got Claire Glynn, who's our Clinical Operations Director for PAM Physio Solutions. And again, Claire is an OC Health Physio by background. And then we've also got Janet O'Neill, who's the head of our Occupational Health Training and PAM Academy, and is also the deputy head of the National Occupational Health School as well. They both bring a massive wealth of experience and expertise in the field of occupational health when they deliver this presentation today, talking about obviously managing sort of sickness, absence and health and wellbeing of employees. So what we're going to cover in today's session then is what's driving MSK or musculoskeletal absence and why early intervention is so important and why it matters. The importance of the role of managers in creating that culture of care and driving those in-work referrals. How best to unlock access to physiotherapy and particularly OC Health Physio by allowing employees to refer themselves. We've got a couple of case studies as well that we'll go through to show how this has helped to empower employees and get help sooner and what the benefits have been. And then also some top tips for putting in place some proactive approach to resolving MSK absence. And just to start off with a statistic that we do have there, 6 out of 10 managers will wait until an absent employee has been off for over a month before they refer through to physio. So obviously a lot of managers are still not referring people early enough to get that right help and support with their return to work or maintaining people in work. So I'll hand over to Claire and hope you'll enjoy the presentation this morning.
Thank you, Tracy. We're going to continue that theme of looking at a few statistics after the relatively concerning statistic that Tracy enlightened us to there. So the first thing we want to address is, as Tracy stated, what's driving MSK absence and why early intervention matters. So we found from the research that the evidence identified that early intervention and early referral into physio inevitably supported the prevention of sickness absence as a consequence of an MSK issue. And in fact, 60% of colleagues who were referred to PAM Physio Solutions whilst in work didn't experience any absence, which is great. And equally, 56% of colleagues who were referred at the point of absence for physio support were able to return to work within a month of their absence. And the reason for this is simple. Prevention is better than cure. And if we as therapists can participate in engaging conversations early on with colleagues experiencing ill health and provide advice, support and signposting to initiatives to assist with recovery and the prevention of the progression of a musculoskeletal condition, then we can conceptually prevent that perception that work should cease. So if we also engage with employer, which is our role as an occupational health professional, which is different to that of the GP or primary care, who are clinical professionals who advocate for the patients, then we can have a really positive influence. So what are we looking at in terms of reported issues and what's the prevalence of those reported musculoskeletal issues? You can see here from this chart that predominantly and potentially unsurprisingly, Back pain is the most highly reported condition, which is also reflected in the HSE annual research findings. So our research established that almost a third, that's the 29% line, of absent employees struggle with back pain, while almost half, which is 49%, of those struggling with an MSK issue whilst at work are also affected by back problems. Fortunately, the number of people affected by serious medical conditions such as inflammation of the spine is rare, and instead it's 11% of those are off work and 27% of those struggling to perform at work are experiencing what can be termed as backache. So this is indicative of strained muscles and ligaments, typically resulting in what's called mechanical lower back pain. Now, there's characteristically no reason why individuals struggling with backache can't be quickly rehabilitated and supported to stay in work. However, the prevalence of backache referrals shows that far too many employees are struggling to maintain good back health, which is something that organisations would be encouraged to start to address. So the other major causes of absence were lower and upper body pain, and that's ranging from shoulder issues to stiff joints and affecting more than 1 in 3 employees. And more than 1 in 10 of those absents were off work due to a fracture or broken bone. Oh, you're on mute, Janet.
Thank you for that. That's nothing unusual, is it? In fact, I'm surprised I managed to get it this far. So I'm going to pick up the role of managers in creating a culture of care, because that's extremely important in picking up that people have issues. And the statistics that we were able to show in our report, that actually positively 72% of managers referred into physiotherapy while still in work. However, there was still a quarter of managers that actually waited until the employee went absent before offering access to that physiotherapy support. And if we go back to a previous slide that Claire went through, that of those managers were waiting over a month before referring in. So that's around 28%. So just more than a quarter, which is still quite a significant amount of people that could be supported to stay in work and instead of becoming absent. So on the whole, managers are being quite proactive, but those that aren't, maybe because of a lack of awareness or a lack of a good conversation, as we say, which is part of that culture of care. A previous report that was actually published by PAM on early intervention success, and that's available on our website if anybody wants to have a look, that demonstrated clearly that getting to people before they go off sick drastically reduces the likelihood of absence. So people talk about good work being good for health, and that culture of care is a significant part of good work. There really is so much evidence out there on the importance of the line manager in an employee's well-being at work. They play that central role in determining an employee's health, happiness, engagement in that sort of culture of care. And Gallup recently found that managers can actually account for 70% of employee engagement levels, which is a huge amount. Really a linchpin for organizational employee well-being efforts. So even if you have senior managers setting the tone, allocating resources, doing great policies and procedures, it's the line managers who ultimately facilitate those efforts with their team members and therefore their engagement. But to do that, line managers need to build trust and confidence. They need to be promoting that health and well-being. They need to create that positive and compassionate environment. And that, of course, includes having knowledge and awareness of the health and safety risks, including musculoskeletal risks in work, but also the importance of supporting individuals, even if the concern didn't arise at work, if it's going to impact on their working ability. So that obviously doesn't always come naturally to some managers who may be really task focused. So managers may need training, education from their organization in order to support that culture of care. And they need to training on creating that environment where employees feel safe to speak openly about their health and well-being. So being able to come to their manager talking about a musculoskeletal discomfort. Just as an aside, we do have a free webinar on courageous conversations for managers, which is on our YouTube channel, as well as a framework of well-being. So completely separate webinars that you're welcome to view. And of course, it's especially important for those honest conversations and awareness, incorporating resources that are available. So for example, those physiotherapy resources, but having that genuine interest in people is essential. And that includes that encouraging early reporting of any incidences of any muscular discomfort, and of course the solutions that can help people stay in work whilst recovering and receiving treatment. That psychological safety. And if you don't mind moving slides, Claire, that will be amazing. Fantastic. So this comes down to the 6 R's. And that's obviously the responsibility of the line manager to manage those musculoskeletal disorders effectively with the reducing the risk. So therefore the risk assessment around, what could impact somebody's musculoskeletal health in the workplace, as well as if they have a musculoskeletal problem, how is that going to affect the way that they work? Recognition of musculoskeletal disorders, understanding what those can be, encouraging employees to report that on day one, that day one reporting of discomfort, referring into treatment on day one or as close as possible, as we've discussed. And then supporting people to return to work if they're off work, but also return to normal function. So getting that support to phase them back into their normal productivity and requirement tasks within the role. And of course, training on risks and awareness also encourages good ergonomic and manual handling practices. So that risk reduction, if you like, as well as providing that training and awareness on what to report and when, and really aids that depth of psychological and physical safety, which of course contributes to culture. And I think I'll be handing over to you again now, Claire.
That's right. Thanks, Jenna. So how can people unlock access to support? So there's a multitude of ways to access support for many different organisations, and I can talk about what we at PAM Physio Solutions can deliver to support colleagues experiencing MSK concerns. So we have very clinically robust, evidence-based and bespoke models for all industries and individuals, and that there's a beauty to what we can do as occupational health physiotherapists within PAM Group, as we have access to a multidisciplinary team of support and professionals, and we have the capacity to learn from each other as an MSK intervention team too. But what does that mean? It means that we can be accessed remotely or in our own clinics, or on site at organisation locations. We can make our service and the model fit your industry and your organisational and cultural demands to make sure you get the best out of the service. Our primary passion is to get people better and to get them better sooner rather than later. But for those colleagues who are experiencing more chronic or persistent or trauma-based issues or problems, then we have a menu of additional supporting services such as persistent pain rehab, awareness programs, workplace assessments, ergonomic risk assessments, body mapping workshops, manager training such as manual handling training and DSE training, and that's just to name only a few. The key is the colleague and manager experience. So we encourage a seamless service of connected health to ensure the journey from referral through to recovery and discharge is clear and personalised. So I want to talk about a couple of cases, some case studies that we've conducted on the back of the projects that we've completed and supported clients with. The first is Marks and Spencer's, who I'm sure you're all aware of in some capacity. M&S decided to enhance their employee benefits package offered to their colleagues by launching a free physiotherapy service. So this allowed any of its 60,000 employees affected by an MSK issue to self-refer for advice and up to 6 physiotherapy sessions, which we were and are delivering at PAM Physio Solutions. The previous approach prior to this change to these types of intervention had always been via a manager-led referral process, which is a process that can and does cause delays. So we promoted proactive ownership of health and wellbeing of M&S colleagues through various different platforms and modalities, and we committed to the provision of a clinical appointment for anyone who self-referred within 4 days of them reaching out to us. And Simon Croker, who is the service manager for colleague services at M&S, identified a 4-time increase in referral volumes and added that at a time when NHS waiting times and rising costs are making it difficult for employees to access physiotherapy, this service model allows Marks and Spencers to empower their people to look after themselves. And additionally, Simon observed the benefits of early intervention through the self-empowerment model, explaining that early intervention matters because the sooner employees can be helped to recover, then the more likely they are to be able to return to remain at work, which is also good for their financial and mental health. So then we move on to example number 2. NTW Solutions are an organisation who provide essential services to the NHS. We worked closely with the key stakeholders at NTW to advocate and support their decision to help employees affected by a health or wellbeing issue at the earliest niggle. We wanted to focus on helping people to stay at work and thereby reducing absence. And we also found that this approach made colleagues at NTW feel more cared for, which boosted employee engagement and loyalty. We trained and championed managers, which is something that Janet has already spoken about earlier. And instead of waiting for staff to call in sick before looking at what could be done to help them get back to work, a more proactive approach was adopted, whereby managers influenced the earliest niggle to help the people stay in work. We also trained managers on the importance of supporting people with health issues to stay at work. This encouraged managers to refer anyone who didn't feel right in themselves into PAM while they were still at work, so they could be consulted with by a relevant clinician within a matter of days and a report provided to the manager advising of recommended supporting mechanism. A day 1 absence service was also implemented by PAM to put employees in touch with a clinician should they have to call in sick. And as you can see here, the feedback from the client is extremely positive and in line with the aims and objectives of our organisational service delivery. Victoria Bullerwell, who's the Director of Workforce Engagement at NTW Solutions, stated that the service design and model helped to significantly reduce sickness absence and generate substantial cost savings. I'm just going to hand back to Janet now.
And just remembering to take myself off mute, which was very helpful. So thanks for that, Claire. So top tips for reducing musculoskeletal related absence. Absolutely supporting people in work. We've mentioned this a few times, and especially when we were discussing culture, helping people to talk about their concerns in musculoskeletal discomfort, but also enabling managers to have good tools in their toolkit, good signposting and facilitating that treatment advice whilst people are in work and help support people in work. And in my experience within occupational health, I've found that it's been extremely helpful to me as an occupational health advisor to support individuals accessing physiotherapy, because it is so reassuring for individuals to speak to a specialist in that area, giving them the confidence and the ability to understand what they can do, what they can't do, and encouragement to actually do those things that they can do without that fear. I think it's also really important to have an idea of what adjustments could be suitable for individuals in certain situations. So, for example, identifying what adjustments could be put in place if somebody has a shoulder injury and would struggle to, overreach, or if those people have got a back pain and they need to frequently bend. So, all of those kind of things where you have a sort of plan, if you like, of what support can be put in place for how long for with individuals. Many employees will actually be aware of their restrictions and limitations, and therefore those early conversations with managers can help that support and work initially whilst the person is being referred. And also it's about encouraging people to understand that actually staying in work can actually be therapeutic for the condition. It can actually help reduce a deterioration, that whereas going off work and just sitting and becoming sedentary might have a significant impact. So that early musculoskeletal and treatment and advice can dispel any myths about using an affected area or working in a particular way, or explain what further limitations might need with support. And certainly taking careful note of any advice that's provided in a management referral report that comes out of a musculoskeletal team, and discussing that with an individual helps with that culture of care, if you like. And I would also say to line managers, encourage your employees to take a copy of the report, if it's coming, a musculoskeletal report, if there is one, to their GP, so it sort of closes that gap and helps their GP to be on board. But as mentioned before, training managers is really, really key. If managers aren't aware of the risks of work, they don't understand the impact of injury or limitation can have on an individual, they'll not really be able to help to deliver that culture of health and well-being. And then just to reiterate that open and honest conversation, so that people feel comfortable going and speaking to them about a discomfort, and don't feel as if they're going to be disbelieved or discounted. And that may not come naturally to managers when they're really quite task focused. Understanding that building of culture of psychological safety is what I'm trying to say, really. Also, it sounds strange, but actually managers need training on what policies and procedures are out there within the organization, because sometimes it can be a disjointed, as that an organization has these wonderful policies and procedures to support individuals. They have these tools, but if the managers aren't aware of them, then they're not going to be facilitating, as we talked about before, and signposting individuals, and not discounting psychological service as well, EAP, because pain can affect people quite significantly from a mental health perspective. I'm going to hand over to Claire just to talk about designing out risks, sort of those ergonomics and tools like body mapping, workplace assessments, etc. Claire?
I could talk for days about all the different workshops, techniques, training, awareness, intervention, assessments that are available through PAM alone. But I think in reducing MSK absence when it comes to being a manager is to know what's out there. What does your MSK or physio service offer you? And it's any healthcare professional's conviction that proactivity is better than reactivity, as I stated earlier. Prevention is better than cure. So whilst we talk about referrals being made at the earliest niggles, we also need to look at preventing colleagues from even experiencing those niggles and designing out the workplace risks, as Janet has mentioned. So body mapping is a colleague-led workshop that has a fantastic success in identifying areas of a task or workplace function that increases the risk of future MSK problems among a specific workforce. So we facilitate workforces communicating with each other about what issues they may have experienced in the past, or that they do currently experience and how they've overcome that. And it makes them involved in part of any change process, which is a phenomenal way of actually implementing and executing change with reduced challenge from a workforce. So then you've got ergonomic risk assessments, which RAG report techniques and movements of tasks. And these types of activity are really positive steps as part of any kind of body mapping exercise. And it looks at moves in looking at the workplace. And that's, you know, equally addressing the health of the people and looking after colleagues and encouraging positive health and lifestyles internally. So what we're looking at doing is hitting the risks from all angles, as well as being reactive in treating those who are experiencing problems. But there's very little positive output in treating someone if part of the reason they've become underfunctional is consequential, even if only in part, to a workplace activity or something that occurs outside of work that they have no control over. So why not address these elements so that when people get better, they stay better?
That's perfect, Claire. I really just love the focus on, yes, reactive treatment support is fantastic. And Claire's mentioned a number of treatment supports today, which the musculoskeletal teams are fantastic at, but they're also really, really fantastic at that proactive, reducing the risk, and they go hand in hand. But on top of that, we also need to be able to support healthy lifestyles for employees and within organizations. And the workplace is a perfect place to deliver that message on health that can reduce the risk, not just of ill health, but of injury. Keeping, especially if it's a physical role, keeping yourself fit. I've often heard people, they've come to me and said, well, I don't need to do any fitness. I don't need to do any exercise because my work is the exercise. But unfortunately, it doesn't work like that. You need to keep yourself physically fit in the round in order to remain physically fit at work. So it's those kind of messages that occupational health and our MSK team can support individuals. Make every contact count is a term that I absolutely love, and we can use every element of our intervention with individuals in supporting that message. Supporting messages around good nutrition that helps with bone and muscle health, not just cardiac health and all other health issues, but musculoskeletal health. The importance of strength-based and flexibility exercise with reducing the risk of injury, and of course smoking has a huge impact. So any messages that we can give, and again, just going back to what Claire was saying, this is really about the proactive, keeping people as healthy as possible for themselves, for their home lives, but also for their work lives. And although we're talking about musculoskeletal, we mustn't forget that promoting and facilitating really good mental health, because our mental health can impact on our physical health, our musculoskeletal health, and vice versa. So about helping people keep mentally resilient, or to be able to access those services, as I mentioned before, EAP, even if it just appears to be a musculoskeletal issue, having line managers understanding how those two can impact, which goes back to education. And that's it for me on this slide.
Wow, that's flown by. Okay, so I guess that's all from us on the presentation side, and we really do thank you for joining, Janet, Tracy and I. We would like to invite you to pop any questions that you have into the chat function, and we'll give you a few minutes to do that, and we'll be happy to answer any of your questions. In the meantime, whilst you're all hopefully thinking up some really good questions for us to challenge us, I'd like to share this slide with you, which is a link to our website, and this holds a plethora of downloadable resources, blogs, videos, useful guides and leaflets and booklets, podcasts, and it also exhibits our service provision. So please do feel free to have a look at that, and these slides will be shared with you, with anyone that's joined today, so you can have a look afterwards too. And then whilst the team are just having a look at what questions have come through, I'll just pop this one up as well. I've just popped up our final slide that invites you to join our mailing list, which allows you to receive all our latest news and updates, invites to free events and webinars, and again, a nice volume of supporting materials to help you with your health and wellbeing and support your colleagues and workforces too. So who's got their eyes on the Q&A section?
We haven't had any through as yet, Claire. I have sort of dropped a message in that if anybody did want to ask any questions, to pop it in the Q&A section. I suppose while we're waiting, one of the questions I had, and I think we often get asked, is that I think sometimes employees are a little bit reluctant sometimes to have remote type of interaction and services and support compared to face-to-face. So how does that work, and what are maybe the benefits of having that remote intervention as sort of early as well in relation to what we've been talking about?
The beauty of early access is that commonly when an individual has that early referral, a lot of what they need is guidance, support, advice, information, education, and things that they can do actively for themselves to help their recovery. And that can all be done by conversations. So it doesn't need to be face-to-face. And it has been proven by several research articles, including one from 2024 just recently that I can easily share as well, that there has been proven to be absolutely no difference in the quality of care that is received, whether it's remote or face-to-face. So it's quicker to get that face-to-face advice as well. So if someone is struggling with any element, I would actively encourage anyone just to have a chat with one of our clinicians and get that advice and support instantaneously. Sometimes that face-to-face can have a delay on it of maybe even a couple of weeks or, you know, up to a week, but we can actually endeavour to have communication with an individual within 24 hours, should that be what the desire is. And that information and that education and potentially myth busting and the ability to give people reassurance, advice, recommendations, you know, even if it's going back to the old rice days of getting something elevated and iced for a short period, and then having that constant communication with an individual has absolutely profound effects on their health and in recovery as well. And that's starting step to the recovery.
Lovely, thanks, Claire.
I'd just like to pop something in. I know we haven't had any questions, but just looking at the slide, I think people forget that actually vehicle workers have ergonomic issues as well, and that's one of the things that I think are fabulous about our musculoskeletal team, is the fact that we can do, you know, that vehicle assessments and assessing people in their actual workplace of a vehicle can be done, and that is just absolutely wonderful and has worked out phenomenally well for lots of different clients that we've had where there are a lot of drivers involved.
Lovely, thanks, Janet. Any questions from anybody else? No,
nice easy one for us.
Yeah,
nice
yeah.
Easy one, yeah.
So just to finish off with then, just to explain that obviously we've been talking about a lot of the information that's come from the report that was produced, nipping it in the bud. So you'll be able to download a free copy of the report. So we'll put the link there for people to access via the presentation. If anyone wants to obviously read and get more information from what we've been discussing this morning. And if you can just move it on, Claire. And if anybody does want to contact us to discuss more about their needs from a musculoskeletal perspective, then we've put the email address there. So please drop us a line if you do have any further queries or questions or want to discuss anything further regarding your workforce. If there are no questions, then again, just to say thank you so much this morning for everybody joining the webinar, and a massive thank you again to Claire and Janet for the presentation and providing us that with the insight and information on the importance of early intervention and being proactive. Thank you all. Thanks, and hopefully everybody. See you at our next webinar.
Thank you very much.
Cheers. Bye-bye, everybody.